Hey guys, I am Dr. Pellegrino from ChiroEdge. I just wanted to quickly go through a nice little research breakdown for the week. We're going to be breaking down 3 things this week. We have a case study on blood pressure change, a case study on anosmia or a lack of smell, and then an article out of the New England Journal of Medicine on risk associated with use of acetaminophen, aspirin, and NSAIDs. So the first thing I want to go over is what I consider to be a very well done case study on anosmia, or basically lack of smell. This is by a few docs, including Chris Gertis, somebody who I graduated with, so definitely have an affinity to this. Shout out to you guys over there. It is a study on network spinal analysis, which is huge for this because the mechanism in here talks a lot about reorganizational healing. It's taking stress and tension off the nervous system, allowing the body to heal and function better. Now, basically what the case study describes is a 53-year-old woman who came into a chiropractic office, and originally she had heard about chiropractic and high blood pressure, so she came in, and what they found was that she had lost her sense of smell from a car accident 9 years previous. All right, so that loss of smell is most commonly associated with aging. It's considered possibly a normal or comorbidity of the aging process. But for her, it wasn't. 9 years previous, she was in an accident. She had a contra coup or a whiplash type injury and lost her sense of smell from that. They took x-rays, and what they found was that S shape of that curve, that whiplash type curve of the neck versus the normal C shape. And what they proposed was that when her head was jarring back and forth in the accident, that there was actually shearing of the nerves coming through the cribriform plate. Okay, actual physical shearing on that. Okay, something that's seen, that's visualized. The medicine is well aware of that. All right, and by taking stress tension off the nervous system, allowing the body to heal, they proposed that the neurons in that area were actually able to regenerate. Okay, and her sense of smell restored. It took about 5 months of NSA care, of chiropractic care, to actually restore a lot of that, or restore that sense of smell. Saw improvement in the structure of her spine. And just absolutely fantastic. So that's a really good case study. That's in the Annals of Vertebral Subluxation. The other case study that we have is on blood pressure. This was published earlier this year. Basically describes a 50-year-old man who had some neck pain, some low back pain for the past 5 years, and had been suffering from hypertension for 24 years. Now, what they did was they took blood pressure pre and post every adjustment that he had over a period of time, and what they found was that on average, and this is using diversified, on average he had a drop of 9 millimeters of mercury systolic and 4 millimeters of mercury diastolic every time pre-post adjustment. All right, so we're not looking necessarily a long-term change there, but to just show the pre-post adjustment by taking us out of that sympathetic dominance, allowing that parasympathetic to thrive by doing specific adjustments, that diastolic and systolic were able to come down, which is absolutely fantastic. The last study that we do is not a chiropractic journal, not a chiropractic article, but it's actually, it's called Risk of Kidney Failure Associated with the Use of Acetominiphine, Aspirin, and non-steroidal anti-inflammatory drugs, or NSAIDs. It's out of the New England Journal of Medicine. What it demonstrated was that heavier acetaminophen in use, apparently I can't talk, was associated with an increased risk of end-stage renal disease in a dose-dependent fashion. This simply means that the more of a drug that we take, the more acetaminophen we take, the greater the increase of this risk. Okay, and what was shocking was that as little as 1 aspirin a day could increase that risk of kidney failure by over 100%, by 110% increase, right, which is definitely significant, right? So what's important to know here is that as chiropractors, if we can, right, we don't treat aches and pains. It's not about not taking medicine, but if by allowing that person's body to heal and function better by correcting the cause of nerve interference, by reducing subluxation, if by correcting the cause of interference we can allow that person to be able to take less medication, right, that's going to even greater impact their quality of life, which we're already going to be doing by adjusting. So that's this week's research breakdown. I hope you guys enjoyed that. You can post any questions right down below here on the comments page. We're going to keep doing these every week, bringing you guys some certainty in the beginning of the week. Dr. Anthony Pellegrino from ChiroEdge, thank you guys so much for listening.